Hello. Yes, we were talking about infrazygomatic crest tats. Now we'll be discussing where the tats come into play. The infrazygomatic crest tats come into play. What are the indications of the infrazygomatic crest tats? So it is like the whole arch retraction. You can also do distalization, a whole arch distalization, en masse retraction, whole arch intrusion. All these can be done with the help of infrazygomatic crest tats. It has to be placed both sides and the force can be given and the whole arch movement can is possible with IZC tats. And now we'll talk about the dimension. The IZC tats are available in two dimensions, 2 into 12 and 2 into 14. 2 is the diameter and 12 is the length and 14, two lengths are available. So once we try to place the tats, I told you how to place the tats, what is the first angulation with which we need to insert it, and then how gradually we need to take it towards the tooth and place the tats. There is a minor difficulty during placing the tat. As we know that zygoma is a curved bone, and during the placement of tat, we need to appropriately locate the infrazygomatic crest where we need to first put the implant screw, the tip of the screw 90-degree and gradually incline it towards the tooth and then insert it. The major disadvantage is that, as you can see, if I don't put it accurately, there is a chance of slippage of the tats. So I need to put it very accurately and then place it first 90-degree and then gradually incline it towards the tooth where the angulation might lie between 45 to 70 degrees. There is also a chance it might perforate into the sinus. See, as you can see here, it might perforate into the sinus. So these are the major disadvantages. But as we know, it is it has overcome the envelope of discrepancy, and tats have avoided the need for orthodontic surgery in a large. Okay.
Lot of wonderful point you have told about it. Now about the orthodontic surgery. What is the basic problem apart from this tags? So can the use of tags really minimize the use of orthodontic surgery?
Yes, definitely. With the use of these tats, where we need the whole arch movement, like bringing the lower jaw anteriorly or taking it posteriorly. Same with the maxillary jaw, taking it posteriorly or bringing it anteriorly. Even the intrusion, most of them have now become possible with the help of these bone screws.
That's great. What can you hint something about the orthodontic surgery? We know that it is causing problems in terms of fear, non-acceptance, might be involved with mortality and morbidity.
Yeah.
However, it might include some other complications also. So can this be overcome with the help of tags in dental clinic scenario?
Yes, definitely. As we know, in majorly in class 3 and class 2 skeletal cases, we need to undergo orthognathic surgery where we need to move the jaw as a whole. Like in class 3, we need to set back the mandible to achieve the perfect occlusion as well as the aesthetics. This can be possible with the help of buccal shelf tats. And in case of class 2, as we know, if the maxillary bone is too much protruded, we need to undergo orthognathic surgery and place the maxilla backward, where again this IZC, which we are talking of today, takes it back, like distalize the whole arch and get it to occlusion and aesthetics.
So here we know that it is an online forum where we can find these concepts can be useful to some, can be very much useful to somebody, and can be non-attainable, non-accessed by the public. So can you explain in terms of the class one, what is class one, class two, with the help of these models we can line?
Talking of class 1 malocclusion in dental and class 2 malocclusion. First, let us know what is class 1 malocclusion. Class 1 is when as you can see, this is a perfect example of class 1 malocclusion, where the mesiobuccal cusp, I'll mark it for you. This is the mesiobuccal cusp, and this is the buccal groove, where the mesiobuccal cusp lies in the buccal groove Yes, can you guys see? This is a perfect example of class 1 malocclusion. Class 2 malocclusion is when the distobuccal cusp lies in the buccal groove. That is class 2 malocclusion. And class 3, the premolars mostly lies in the buccal groove around inches. Hope you could understand what is the malocclusion.
Okay. So exactly they've got that. What is the forward placement of the maxilla? Can you show it here and how it is going to get retarded? Can you just show it here?
Yes. So when we are placing infrazygomatic crest stats, we will be placing.
Now, what is the pre-existing condition that you are going to treat?
Yes. So if you see here, this is class 2 malocclusion. And as you can see, there is an increased overjet here. Sagittally, you can see that there is an increased overjet here. So we need to get the whole maxilla back into class 1 occlusion, where the mesobuccal cusp will occlude with the buccal groove. Now you can see there is a perfect overjet, and this is how we have to achieve class 1 malocclusion.
Thank you.